Hello YouTube. Today actually I don't have much to report. I mean, everything's been the same for the last week. I'm just cannot wait for my surgery. But I wanted to talk to y'all a little bit about something that I've been researching about. Like I said on my last video, I was gonna be researching about prevention of blood clots after surgery. So I'm gonna tell you a little bit about that, about what I found, and I will actually post the on my reference, like on the bottom of the page. I will post some references in case anybody's interested in looking at the journals. I got some of the information from. Now, please excuse if I'm looking down, but I have my notes here to make sure I don't forget anything. But anyway, so it is very common to have blood clots on people that have any type of surgery. And by very common, I don't mean like it happens all the time. What I mean is it's a real risk factor. Having any type of surgery is a risk factor for blood clots. And so especially with people like us, are obese, or in 2010, the American Heart Association, they published a list of risk factors. Some of the things that actually cause more people that have these things are more likely to have blood clots, or what they call venous thrombosis or thromboembolisms. An embolus is a blood clot that moves. It's not one that is actually attached to the vessel, but it's one that moves. And what is so dangerous about those is that it can go to your brain, or it can go to your lungs, and pretty much kills you if it travels that far. And if it doesn't, it can go to other places such as muscles or other areas, and it can cause a great deal of damage. So that's why you really want to prevent those, if at all possible. From what they gather from their publication, some of the things that they said that had the highest correlation, meaning that it was the most likely, you're more likely to get one, to have a thrombus or an embolism. It will be if your BMI is high. And of course, if you're having the gastric sleeve or any other type of bariatric surgery, pretty much your BMI is going to be high. So that's that's for all of us is something very important. Also, if you're currently smoking, anytime you're smoking, you are at greater risk for having a VTE, which would be the venous thromboembolism. So if I say VTE at any point, that's what I'm referring to. Please make sure that you quit smoking before you have your surgery, and don't start right after, because right after surgery you're more likely to have an embolism or a VTE. But they did research. Their research showed that even if you had smoked before, that didn't increase your risk. It's just currently smoking is what increases your risk. Also, if you have a high diastolic blood pressure, that also increases your risk. And one of the things that I found really interesting was that if you have lower education, that also increases your risk. I'm not really sure what that was all about, but I did found that was one of the things in their list. Those are all things that are associated with it. Now, some of the other things that I found that are also associated are if you take any type of birth control pills that are made with estrogen, that increases your risk greatly. Birth control pills do. And so another thing for bariatric patients, this is something that I found at the CHEST journal, which is the journal for the American College of Chest Physicians. They also put guidelines and things like that for surgeons, especially surgeons that deal with anything to do with the heart and the chest and anything like that. But one of the things that they said on their report was that the risk for bariatric patients was increased if they were elderly. So the older you are, and if you're having bariatric surgery, the more likely you are to have a VTE. Also, if you have a previous VTE, or if you have an anastomotic leak, I'm sorry for my pronunciation, but my accent, I can, do much about that one. But anastomotic leak is pretty much a leak that happens in between where two vessels meet. Two different vessels, like two different blood vessels. When two different blood vessels that are feeding one area of the body, they come and they meet there, and they provide blood flow to a certain area. So if there's a leak in one of those, somehow it increases the risk. I'm not 100% sure how that happens, but that is one of the things that they did say in their paper. Now again, going back to the American College of Chest Physicians, the name of their journal is called Chest, and so if I ever said chest, that's what I'm referring to. And so they wrote in 2008, they wrote some guidelines, and the guidelines talks about preventing any type of thromboembolism anywhere, for any different types of surgeries and traveling and all these different things. And so some of the things that I found was that they stated that after that the incidence of VTEs is lower after bariatric surgery compared to other types of surgeries. Some of the reasons he was talking about is like a lot of them are being done laparoscopically, and also people are being discharged pretty soon after. And even though we have greater risk factors because of obesity and things like that, they have found that actually we do have they're pretty low, a risk of VTE, but it's still a very, very dangerous thing. So you want to do the best you can to not be one of the lowest statistics. So everything should be done to be prevented. One of the things that they said is that the majority of the VTEs happen after you've been discharged from the hospital. Many of them happen without nobody knowing that they're happening, because a lot of them don't have any symptoms. So they're asymptomatic, and you won't know until pretty much you're dying. And unfortunately, I actually experienced not long ago, my friend's son died after a car accident. He had a car accident, and he had an injury to his leg, and he got a blood clot, and he actually traveled to his lungs, and about a month later, and he died from a blood clot. And he had no real symptoms before then, and it just all of a sudden happened. So that's why I'm saying it's a real risk that, and he was in his 20s. He was really young. So it's something that we should all be really aware of and do whatever we can, whatever is in our power to try to minimize that. So chest, the recommendations for bariatric surgery is the use of what is called thromboembolism. I will spell it out on the screen for you, but it's pretty much it's a pharmacological, a drug that they use to prevent blood clots, to prevent them from forming. Is the main thing that they do, prevent the formation of them. And so one of the things that they recommend is what is called a low molecular weight heparin. They have other different types, but that's just one of them. And that one just, the low molecular weight heparins just tend to have a little bit less side effects than heparin by itself, and less bleeding risk and things like that. They, however, do not want anybody taking aspirin, especially if you travel. I will talk a little bit about that in a minute, but aspirin can cause a lot of bleeds, and aspirin binds to some of the receptors. They prevent the clotting process, but they bind permanently until you make new ones. So it's very important to, if you're taking, some of the recommendations have been that if you're going to have surgery, to stop taking anything that has aspirins at least 7 days before the surgery. But make sure you talk to your doctor about that. one of the other recommendations that they have for people that are having bariatric surgery is what is called an intermittent pneumatic compression, which I know some people have seen them. They're like machines that they put this thing around your legs and they pump air into them, and so it squishes your leg and releases, and so it continues moving your blood, so it helps movement of the blood. Now I know that some doctors do not use those. They use what is called a graduate compression stocking, especially if you're going to Mexico and things like that. There's been research done on those too, and they also prevent blood clots. Now, if you're somebody that has a BMI of 50 or something like that, it is recommended to actually have the intermittent pneumatic, so the machine, the electronic machine, instead of just the socks. But if your BMI is not that high, it's not really, the only problem with the stockings is that there just hasn't been as much research done on them, but they do show to have, also to help. So talking about the stockings is, I was going to talk to you a little bit about the traveling. Some of the things that they talked about in the journal was also that prolonged air travel it appears to be a risk factor for VTEs. And it's not just air travel. It actually is any type of travel. It can be even in cars. If you're in a car for a very long period of time because of your seating, your blood is pooling on the bottom of your legs. And so it's really important to get up and move around and things like that. Also, even for after surgery, they recommend moving. They recommend walking. It's extremely important to walk because that will actually decrease the risk of BTEs. But it's not just important when you're in the hospital. It's also very important when you leave the hospital to continue doing that. Even if we're feeling sick and miserable, at least every once in a while, get up. I mean, I have a goal of doing at least 10 times a day. You know, getting up and walking around a little bit for 5 minutes at least, and you know, but so any walking that you can do is extremely important. The research showed that if you were traveling 8 to 10 hours, which I know some people do, especially when they're going to other countries for their surgery, or if you're even traveling that long after, like 8 weeks, I believe, 8 weeks after surgery, you increase your risk a lot to have VTs. So one of the recommendations is either have one of those low molecular weight heparin injections before you leave, or using the compression stockings. That has shown to really lower the rate of VTEs. Almost take them out pretty much. So it's important to use those, and it also helps with the swelling. A lot of people swell after flying and things like that, and so it actually minimizes the swelling a lot. But they also say no aspirin, because aspirin actually showed to cause more problems. I don't remember exactly what it was, but so they do say do not use any aspirin. And so the graduated, you may see them if you're buying some for yourself or whatever. Some of the graduated compression stockings is to use at 15 to 30 millimeter per Hg of pressure. And my daughter is laughing at me, and I am going to embarrass her.
I'm not laughing at you.
Oh, she's laughing at her pictures that she's watching. I thought she was laughing at me, so I like embarrassing her anyway. But love you. But so anyway, that is the information I got. I will, if anybody's interested in them, in the papers themselves or any information about the papers, please email me. I will post my email address that you can contact me at, and I will send them to you. I actually have a lot of them. And so I just gathered some of the information, and I believe next time I'm going to be talking about gremlin, which is a very important hormone that I'm sure a lot of us have heard about. It's part, they cut a lot of it, a lot of the places where it's produced after the surgery, and so that's what I'm gonna research this week. But I was gonna just show y'all a little bit how I look, and my daughter's gonna hold these, and so just so y'all can see how big I am. And we've been doing laundry, so there's a mess around me. But see y'all next time.